Today I will demonstrate a case of grade 6 baldness. He was having complete baldness with some existing hair. This was the area of his complete baldness, and we planned around 3400 grafts for the front mid area coverage. At what age you started losing hair?
At the age of 20, when I was in Mumbai in year 2019, like hair loss started like at the starting phase.
How you decided to go for a hair transplant at Alloroots?
Eventually, after years and years, I faced too much hair loss. But after my international trip on in 2022, it increased more. I was searching for hair transplant since 1 year in 2022, 2023. So, like, I got to know from one of my family friends who have done hair transplant from here, Alloroots. When I came to Alloroots, like the staff was very good. So the behavior was very good, treatment was very good. So when I got into the surgery room, it was very comfortable for me. The environment was not very stressful. Like it was very good. Like the environment should be very good to have a good surgery.
Today we have with us Mr. Sayan, who is 27 years of age, and he undergone a procedure almost 2 years back, I think in May 2024, right? And at that time he was only 25 years of age, and we planned around 3400 grafts for the front mid area coverage, and now he's with us with 2 years of regrowth. So, hello Sayan. Tell me about your hair loss. Since at what age you started losing hair, and what are the treatments you have taken, and how you decided to go for a hair transplant at Alloroots?
So, sir, at the age of 20, when I was in Mumbai in year 2019, like hair loss started like at the starting phase because there was water was different. Iron was very rich, high in the water. So I faced a little bit of hair loss, but like eventually after years and years, I faced too much hair loss. Like I've gone for treatments, for Ayurvedic treatments, for homeopathic treatments. I've even used minoxidils, finasteride, everything I've used. But after my international trip on in 2022, it increased more. Okay, so that's why the last resort for me was hair transplant. I was searching for hair transplant since 1 year in 2022, 2023. So like I got to know from one of my family friends who have done hair transplant from here, Alloroots, in Jharsuguda. So I came to know about this clinic. I came to know about you. So I've talked with him. Then he said, no, you can go for it. It is like non-invasive, and there's no issue about it. So that's where I got to know about Alloroots, and I came here.
Hair transplant in young age is a bit challenging because the ongoing process of baldness, your donor is not stabilized, so we have to very carefully plan the procedure. And when we did his surgery, at that time he was only 25 years of age, and in first sitting we planned somehow around 3400 grafts covering the front and mid area, basically to have a conservative management from the donor area. And as correctly informed by him, he was regularly on treatment with medication, and he was already having baldness, and in that stage the only option to regrow hair is hair transplantation. And many of people usually having phobia for the procedures. There are a lot of misinformations in the internet, and they think it is very painful. There will be a lot of side effects after the procedures during the surgery. So can you explain like how was your experience during the surgery, and what are the extra care you have to do post procedures, and any side effect or complications you have encountered, because already you have completed 2 years. It's a very significant time. Can you just explain your experience so far, and specifically how much painful it was during your procedure?
So when I came to Alloroots, like the staff was very good. So the behavior was good, very good. Treatment was very good. So when I got into the surgery room, it was very comfortable for me. The environment was not very stressful. Like it was very good. Like the environment should be very good to have a good surgery. The surgery to be successful, environment is like depends upon the environment too. So it was a very good surgery for me, and very less painful, to be very honest, because during the anesthesia it pains a little bit, because of the needles, but after the anesthesia you won't feel like any pain at all. So as I also documented it, the whole procedure in my blog also. So it was a very smooth procedure, to be honest. There was 2 sittings, one day for like 6 to 7 hours, and another day was 2 hours.
So because it was a long surgery, so
Yeah.
we prefer to do it
2 sittings.
over 2 days,
Yeah.
like 2 consecutive days.
Yes.
So, yeah.
So it was a very smooth procedure, and people can go for it, and there's no
People
stress.
sometimes ask me like, do I need to take extra care, extra maintenance? So what was your experience? Did you have to do any extra care to protect the hair, or like a routine care?
It was a kind of routine, but bit of extra care, because after surgery, at least for first year, you have to maintain it very like carefully, so that the grafts remains good and the growth remains good. So that's why I took every medication doctor prescribed me. So I took it, and then particularly for the shampoo, medicated shampoo, I showered with the medicated shampoo. Yeah. Yeah, I had some dandruff issues as well. So that's because I shifted to another shampoo for dandruff as recommended by you. So it was a good experience. After 2 years also, like, it was good for me. And if you don't care for the hair, then it will eventually fall.
Basically, the transplanted hair, so they don't need any extra care. But
Yeah.
yes, for the existing hair,
Yeah.
you have to have some medical support.
Yeah.
And which is very important to understand if you are going for a hair transplant at a very young age.
Yeah, true. Like, yeah, you can, like, the PRP is very important, because in 3 months, every 3 months you should do PRP, because it will protect your existing hair as well as transplanted hair as well. So yeah, that's it. When we are planning hair transplant in a young age, especially those in age group below 30, it's very important to plan the procedures in a careful manner, because in that age group, your baldness is progressive, the donor is also dynamic. So if and anyone having baldness at this young age is not the right candidate for hair transplantation. So we have to have proper stabilization of this ongoing process of baldness. Your donor should be healthy, and with proper medical treatment, first we should stabilize the hair loss, and then we can go for a hair transplantation. And when we plan hair transplant in this young age group, we prefer to go for a conservative hairline, and also to have a conservative management of the donor, so that we will have adequate reserve to address the future requirement, and also to avoid any grafts taking from the donor area which in future may undergo thinning, so that we can get a long lasting result with a proper management of the donor.